If you're about to undergo a root canal procedure, this video is meant to educate you and ease your fears. Your dentist will always have a sterile and well-organized environment to provide you with a safe and efficient procedure. All tools will be kept inside the sterilization pouch until the treatment begins. After your dentist numbs the area near the tooth, they will place a rubber dam around it to keep the area dry and free of saliva during treatment. A high-speed handpiece will then create a point of entry into the tooth to allow the dentist to easily access your tooth's inner pulpal chamber. A safe cider file's main purpose is to clean the canal. This can be done manually or via an electronic handpiece that moves back and forth. There are multiple file sizes meant to gradually clean and remove tooth debris, each making the hole a bit larger. There are multiple benefits to both ways, and they can be used interchangeably to suit the patient's needs. After the excess debris is removed, a probe is used to locate the canals. Finding the canal manually can be time-consuming or difficult for the dentist. Luckily, by using a microlight, dentists are able to magnify the inner chamber, helping them to quickly create a more pleasant experience for you. Once the canals are thoroughly cleaned with a sodium hypochlorite solution, a gutta-percha, which is made of a time-tested rubber that will never be altered, is placed into the canal. This is the same shape and size of the file, so it can replace the hole that's been created. Cement is then added to fill the space.
What risks are associated with a root canal?
The three main risks associated with the root canal procedure are the possibility of an instrument breaking during treatment, missing the canal, and tooth perforation. When a small portion of a metal file is separated inside of the tooth, the file segment may be left behind if attempting to remove it could possibly risk damaging the tooth. But don't worry, having metal inside of your mouth is fairly common, like metal posts, silver fillings, and gold crowns. In some rare cases, this can cause the canal to be improperly cleaned and may need to be addressed surgically. However, these cases are fairly uncommon. Every tooth is different, and some teeth have more roots than others. If a root is missed, the crown can be simply removed, and the missed canal can be cleaned. The likelihood of this occurring is greatly reduced when your dentist uses a microlight while doing his procedure. A perforation is simply a hole in the crown or root. It can be repaired with a variety of non-toxic and easy-to-apply materials.
What caused me to need a root canal?
This treatment is necessary when the soft tissue underneath the dentin, called the pulp, becomes inflamed or infected. This inflammation or infection can have a variety of causes: deep decay, repeated dental procedures to the same tooth, faulty crowns, a crack or a chip in the tooth. In addition, trauma to the tooth may cause damage to the pulp with no visual signs of chips or cracks. If pulp inflammation or infection is left untreated, it can cause pain or lead to an abscess.
Is there an alternative to the root canal procedure?
Yes, tooth extraction is an alternative to this procedure.